We all experience varying levels of anxiety throughout the day. From the sudden worry of being confronted with a pop quiz in class to the fear of making a decision that could heavily impact your future. We are all familiar with the feelings and effects of anxiety in our daily lives. However, for some people, those feelings of anxiety persist even in seemingly normal situations. So, is there such a thing as having too much anxiety? Every year, 4% of the U.S. population exhibits symptoms of generalized anxiety disorder. There are many explanations that describe how and why it develops. We will be focusing on the biological explanations and treatments. Before we jump into what generalized anxiety is, let's make the distinction between fear and anxiety. When we experience or perceive any threat to ourselves, our bodies produce a physical reaction with the help of the central nervous system. We sense danger, feel uncomfortable, our hearts start to pound, breathing increases, and muscles tense up. This is commonly known as a fight or flight response, and these symptoms are what we typically feel when we are scared or anxious. So, what makes the two different? It has to do with the context of the perceived threat. Fear is a physiological and emotional response to a known serious threat to oneself. Anxiety, on the other hand, is a physiological and emotional response to an indefinite, unknown threat to oneself. For example, it's one thing to be afraid of a spider that's crawling on your wall, but it's another thing to worry that a spider may be lurking in the corner of your room. With that in mind, let's get into generalized anxiety disorder. What is it, and how is it diagnosed? Unlike the typical anxiety most people experience and can cope with on a daily basis, generalized anxiety is marked by a persistent and excessive feeling of anxiety and worry. This can interfere with a person's ability to perform daily activities. These feelings can manifest in ways such as perceiving non-threatening situations as threatening, difficulty coping with uncertainty, and indecisiveness for fear of making a wrong decision. In addition, people with this disorder may experience restlessness, fatigue, difficulty concentrating, muscle tension, and sleeping problems. How does a person develop generalized anxiety disorder? From a biological perspective, the origins of generalized anxiety are found within our own physiology. Biological theorists have come up with 3 explanations as to how and why people develop this disorder. They are genes, malfunction of the anxiety feedback system, and improper brain circuit function. First off, the genes people share with their biological family members can predispose a person to developing the disorder. Studies have found that 15% of people who have relatives with generalized anxiety disorder develop this disorder themselves. Second, malfunction in the feedback system that brings our bodies back to homeostasis after an anxiety-inducing event can allow anxiety to run rampant. Our brains are composed of a vast network of neurons that communicate with one another via chemicals called neurotransmitters. When we experience fear or anxiety, the neurons go into a state of great excitability, causing the classic fight or flight symptoms. Eventually, a feedback system is triggered, causing a release of neurotransmitters that decrease the excitability in the brain and bring an end to the feelings of fear and anxiety. Gamma-aminobutyric acid, or GABA, is one of the feedback neurotransmitters that, when bound to the corresponding receptor, causes the neuron to stop firing and helps settle the body down again. Biological theorists suggest that people with generalized anxiety may have too few GABA receptors, or GABA receptors that do not effectively bind with GABA. Lastly, there may be improper function of the brain circuit that produces the feeling of anxiety. The portions of the brain that are active during anxiety are the prefrontal cortex, anterior cingulate cortex, and the amygdala. According to studies, the circuit between these areas of the brain may not function properly in people with generalized anxiety disorder. The effects of generalized anxiety disorder can be difficult to cope with, but there are effective treatments. 3 biological treatment options for this disorder are drug therapy, relaxation training, and biofeedback. Of the 3, drug therapy is a leading treatment. Anti-anxiety medications are used to treat people diagnosed with generalized anxiety disorder. Benzodiazepines are a class of anti-anxiety medications that were one of the first used to treat this disorder. Their effectiveness was attributed to their ability to allow the neurotransmitter, GABA, to bind more effectively to GABA receptor sites, thus allowing for better control of brain excitability and a reduction in anxiety. However, these type of medications do come with some serious side effects, such as drowsiness, incoordination, depression, and irritability. Certain antidepressant and antipsychotic drugs have also been found to be effective in the treatment of this disorder. The last two treatment options are non-chemical techniques that focus on relaxation skills. Relaxation training is used to teach patients how to bring about physical relaxation on their own. Therapists teach patients how to focus on specific muscle groups, tense those muscles, and then relax them. The goal is to create deep muscle relaxation, which can reduce anxiety. This treatment is best used in conjunction with other treatments. Lastly, biofeedback is a technique that allows patients to visually see or hear how anxiety affects their body. With this treatment, the therapist hooks a patient up to an electromyograph, which is a device that takes electrical impulses from muscle tension in the body and turns them into a sound or a visual image on a screen. The impulses can be seen as lines or heard as varying tones. Changes in the image or tone directly correspond with the amount of muscle tension being produced. With practice, patients can learn to reduce muscle tension, create a state of relaxation, and reduce anxiety. Generalized anxiety disorder is complex and can severely impact your life. If you or someone you know are having difficulties coping with anxiety, do not be afraid to speak up or seek help. The school offers emotional and counseling support to those struggling with anxiety. Make an appointment today. You are not alone in this fight to overcome anxiety.